First of all, I'd just like to thank WOTSO for including us here for the presentation. We're always looking for opportunities to promote what we do in rural, remote and regional Australia. Rural, remote and regional Australia, which I'll now call rural, makes up 30% of the population. And I'm sure if you think about your families or friends, you'll know somebody that lives outside of cities. And I'm not talking about just outside of Canberra, I'm sort of speaking about areas that, you know, often don't have public transport. They might have taxis, but they might only have a few. It's pretty expensive. And that's about 7.4 million people. So it's quite a large population. Those 7.4 million people, or 30% of the population, currently bring in 2/3 of Australia's export income. So when you think about funding for education, roads, health, infrastructure, that is where it's coming from. In addition to that, not only do they bring in 2/3 of Australia's export income, they're providing 90% of the food you eat. And part of that export income are from industries like resources, gas, food, wool, sheep, meat, grain, salad mixes, lobsters, everything that you could think of. And while they provide 90% of the food that we eat, even more goes overseas for that export income. And then again, while they only make up 30% of the population, they're bringing in 50% of the tourism income. And that basically means that rural Australia is important for our tourism income, but also that when you have all those people going to rural areas, when you think about the services, the infrastructure that's there, it's actually servicing not only those 7.4 million people that live in those areas, but it's also servicing all of those tourists that go to those areas. So that's the positive. The terrible thing about it is that most people in urban centres don't even think about rural Australia until, and I'm sure you remember this, when bananas cost $12 a kilogram because a whole industry was wiped out. And instead of thinking the whole industry has been wiped out, you're going, why are you charging me this much for bananas? I can't have my banana smoothie, right? Which is, it's a bit insulting for people, right? Because if something happened to, let's say here, and there was a massive storm, I can tell you the government will be here straight away and go, oh, we'll rebuild it and we'll do that. But when it's out there, when people have lost their houses twice in 5 years because of fires, and then they're given a little bit of money, and then they take 7 years to get their insurance back, to restart their businesses, restart the work that they do, and actually get their schooling back, get everything back. It sort of demonstrates that we have this total disconnect, and we're treating rural Australians as if they're third world citizens. The National Rural Health Alliance is an organisation that has 56 members. We go up and down depending on, are they national organisations? Are they delivering healthcare like the RFDS? Are they servicing the policy and the education of the future health and medical workforce in rural Australia? Are they researching in rural Australia? So you've got research institutions. They're all national organisations that believe that rural Australia is not getting the fair amount of money. They're not receiving the policies that they should be. For example, Aboriginal people are living in concrete housing in rural Australia where temperatures go up between 50 and 55 degrees. They're told, no, I'm sorry, you can't have sustainable solar panels because that means that we would have to upgrade our grid. And yet we're happy for you to be in a house that doesn't have air conditioning and we're also not willing to spend money on housing that's sustainable and has verandas and allows for you to be sustainable. And so for those communities, you will notice, and it's probably another reason why people like Pauline Hanson has got this opportunity to get in, even though most people are not extreme in Australia. Most people are fairly centre, but they're just saying we're sick and tired of being at the end of your decision-making tree, and rural Australia doesn't even come into the argument because we're out of sight and the votes aren't there. And so our area of remit is really about ensuring that, first of all, policy reflects urban and rural communities, and they are put in context. I mentioned before about public transport. If there isn't any public transport, you can't just tell people when the fuel costs get higher, oh, you should just work from home, or you can just catch public transport instead. Because it's basically telling them, we don't care about you, and we don't even know that there isn't public transport there. It's also when people hear that the Patient Assistance Transport Scheme, which reimburses 30 cents per kilometre for fuel, when we know damn well that it costs much more, right? And there are people deciding not to go and visit a doctor or a specialist cancer treatment in the city because they can't afford it. Or telling them, oh, look, we'll give you $70 for accommodation when we know at a hospital in the city, if you're going for treatment, or you're going for treatment, that $70 will pay about a quarter of what it costs for a accommodation right near a hospital. Or telling a person that is pregnant, oh, for 3 months of the end of your pregnancy, you're just going to have to be in the city, away from your family. You won't be able to care for your in-laws or your parents. You won't be able to look after your other child, and you're going to have to do that at your own cost. Because I can tell you, if you live at Deakin and that happened to you, and we told you you had to drive, let's go towards Menangle, that's how far you have to drive, and I'm sorry you're going to live there to get any sort of care. I can tell you, you'll probably be in front of Parliament House and say it's not good enough. And you will probably get some funding because it's too visible. So that's the environment we work in. And we've got amazing community members, and I'll give you some examples. I often give these examples because they're so amazing. There's a community based in Bogan Shire. Yes, it's like Bogan, but it's after the Bogan moth. It's about an hour and a half inland from Dubbo. And that clinic was going to disappear. They were losing their doctors and their nurses, and there was no support from anybody. So these people in that community have paid their taxes. They've worked in the industries that are bringing in our export income. In addition to that, they've also paid their Medicare levy. And the percentage of people that have private health insurance is quite high, because rural people, in particular those that are on farms, tend to have private health insurance. And they were almost going to lose this clinic because Medicare doesn't pay for a whole of service. Medicare, when it was developed in 1983, and it's still a fantastic program, but when it was developed in 1983, and it hasn't changed, it was never meant to be a full payment for the service delivery. It was supposed to be a public health insurance or contribution to the true cost. And as you know, in the last 5 years alone, we've had a CPI of 30%. Historically, Medicare, so since 1983, the average indexing, increase, has been less than 1%. Now, we had an increase in Medicare on some items over the last 2 years, but it actually hasn't caught up on the 30%, let alone what the increase has been. And in fact, if you sign up to Medicare bulk billing, which is welcomed by everybody, at some stage with inflation, you're going to be in exactly the same spot where we were 2 years ago, where the cost is up here and the Medicare rebate is here. So somebody has to pay the gap, right? And in rural Australia, that gap is even bigger. And the consults are longer because people are dying between 12 and 16, 17 years earlier because they've got lower access to services, it's more expensive for them, and in addition to that, they have the tyranny of distance, and they're more stoic. And the policy is not fit for purpose often for those communities, because while you might, does anyone know Bondi Junction? Right, it's very central in Sydney. The throughput of those primary care clinics is about 7 minutes. Sometimes they're only 3 minutes. You go in, you've got a purpose, and you go out. And the throughput, you just push through a whole lot of patients. I'm not saying they're all like that, but they generally do not refer to another specialist. They're generally not those patients that have diabetes, rheumatic heart disease, those people that have comorbidity issues. And anyone that is a holistic primary care clinician generally has longer consults. So mental health, for example, those patients that have diabetes, you're dealing with eyes, with blood flow, you're dealing with blood sugar, you're dealing with heart, you're dealing with a whole lot of issues, longer consults. In rural Australia, the consults are longer and the waits for referrals and access is much longer. And so for those communities, bulk billing doesn't work. And so to go back to Bogan Shire, the clinic was going to close down, the whole community gets together and they're raising up to $700,000 a year to keep their clinics open. Now could you imagine the people at Deakin going, we're either going to have to drive to Menangle or we're going to raise this much money amongst us all in our neighbourhood? I don't think so, right? So that is basically what's happening to communities. Mareeba up in Queensland, 1 hour away from Cairns, the same thing is happening. They raise hundreds of thousands of dollars to top up their service delivery. There are clinics all around rural Australia where the community has to raise the funds that is not provided to them. And if you look at the graphs, and I'm happy to send them on to you, if you look at the graphs about service delivery and access to health services, disability and ageing, there is a difference between a city person being funded and a rural person being funded, and it is a difference of between $1,090 per annum per person and $4,700. So if I'm living in Mareeba or in Bogan Shire, I will receive $4,700 less than you living here. And the reason this is an issue is because we rely on these people for our productivity, we rely on these people to support us. The cities cannot cope with more people, and telling them that you choose to live out there is a ridiculous statement in itself when we know where our economic wealth comes from, when we know there is a shortage of housing, and we should be encouraging that relationship between the two. And in the end, for a Western country, these are our peers, our members of the community and other Australians. And so that is basically what we deal with. So our main work is policy, it is advocacy, at a federal and state level, because as you know, you've got the federal system and the state system, and the states provide the hospitals, some primary care, and as you know, Thriving Kids, which is now the cut-off from NDIS, where the states are delivering under 8-year-old support for children that have disabilities or learning difficulties. There's item numbers to have 3-year-old health checks and things like that. And then you've got the federal government delivering all of the other things, including grants for training and education in health. We know from the training of clinicians, like medical and also allied health, nursing, that if the training programs pick rural students to university programs that are run in rural communities, and then they go into postgraduate training programs in those communities, 70% are likely to stay. So training them in the city is important, but we need to flip the model where we pick rural, train rural, and then part of the training program is going to the city to be training hospitals and things like that to get the urban part and to allow people to see other things apart from that community. But actually the culture is that way. They're able to understand what it is like to be in isolated areas. They're likely to understand more what it's like when you have to be more flexible. The breadth of service delivery is broader than a GP that is working in the city, because they can't refer as much. They have to be across so many more things. Look, it's fantastic living in a rural area. It is, if I had not, I lived on a farm near Coonawarra for 30-something years. It was like a real farm, it wasn't a hobby farm. It taught me how amazing and how innovative rural people are. Many of the innovations that we use in the city come from those regions. It is a beautiful place to live, but there are things that you have to be aware of if you move there. And so that understanding of that culture, it's the same as somebody moving from a rural area or moving from overseas to Australia. You need those nuances and those connections, and that's part of our work too, is our connections, the work we do with health literacy. We had a big campaign when Telstra cut the 3G network. We had thousands of people that couldn't even ring 000, and nobody was doing anything about it. We also had a big campaign with the NRHA, so that's about telecommunications and access to digital technologies. On Virgin doing a campaign, there's nothing out here, so it's not worth servicing you. And then when Rex was having financial difficulties, I know it's an international company and many of the investors of Rex were from Singapore, but in the end, if that goes, you basically lose business. You lose populations being able to access services and education. So we had a big campaign in that area. We also have campaigns about infrastructure. There's a lot of the money doesn't get to those communities, and that includes things like roads. I mean, how do you think the food gets to the city? How do you think people are able to go to services or tourism occurs? You need those sort of infrastructures around the communities. We work extensively with other industries because industries rely on the health services. If health goes, the industry and the education sector goes from that community. If education goes, the industry and the health leaves, because we rely on that fabric of, and now I'm talking about infrastructure, not so much physical, but the ability to work together to ensure that there is that ongoing basis. To go back to the graph, and I told you before about the health expenditure. So currently in rural, remote and regional Australia, there's an $8.35 billion underspend in healthcare compared to people in the city. And that is about the equivalent of expenditure that people get in the city compared to the country. 8.35 billion. 2 years ago, we had the same research facility using publicly available data like PBS, so medicines, MBS, infrastructure funding for health, aged care access, disability access, and it was 6.55 billion. In 2 years, it increased to 8.35 billion. And so when we work, we continuously try to raise that profile, and we will work with anybody, because in the end, it actually impacts everybody. And part of it is talking about productivity, part of it is about the fact that we can't have people dying 12 to 16, 17, 18 years earlier. Part of it is that we need to ensure that Australia is sustainable in terms of housing and supply chains. And part of it is about Australians are, one, they're not having 2 or 3 different types of life expectancies, and that includes Indigenous. So Indigenous people, 2/3 of Indigenous people live in rural, remote and regional Australia. Unfortunately, we often see the people that are troubled and at their wits' end, or alcoholic or whatever. The media tends to portray all Indigenous people as the people that are misusing or abusive in communities, like what's happening in Alice Springs at the moment. I've lived in Alice Springs. There are many positive things in Alice Springs, but it's become a real problem. And so part of our advocacy is to work with our Indigenous friends and entities that support the health and education sector and housing sector to ensure that their voice is heard. Whether you believe in the voice or not is actually irrelevant. It is more about whether you believe that Aboriginal people deserve the same as others in terms of education access, in terms of consistency of fresh fruit and vegetables and meat, in terms of the ability to be able to access health and medical careers, and do they receive that support? So that's probably it. You know that all of the health issues are greater in rural Australia. That's probably all I can provide. You can tell we're passionate. Our team is a really hard-working team that is passionate. We've got a person up in Queensland. We've got a few more staff members that are not here today, but I'm open to questions.
I don't have a question, but I just want to say what great work you all do.
Thank you. We really try. Sometimes you feel like you're bashing your head against a brick wall, and sometimes we have little wins, like the National Reform Agreement, which is the agreement between the state and the federal government that's just been signed recently, and we lobbied for a rural Schedule F, and that is in there. Is it going to be something meaningful? We're not sure yet, but at least it is something, a vehicle that we can actually try to influence. We were also really happy that social housing for Aboriginal people was on the agenda. That's really important, and we are great supporters of Aboriginal people having the opportunity to be able to be trained as nurses, allied health professionals, or to be able to work across states, because at the moment we've got Aboriginal health workers that even during COVID, even though they live right on the border and used to provide services to both jurisdictions, they might have a scope of practice here, but it's different in this state. Like, it's ridiculous. It's a man-made line, right? And so we work at those sort of things to make sure, and we're not scared. We receive some of our funding through the federal government. It's not our only funding. So we do need to toe the line with some things, but actually we raise the things that are difficult conversations, and we're willing to call it out, because if you don't call it out, you're actually the same as a person that's standing by while somebody's being bullied. It's exactly the same. We need to stand up and go, this is not enough. It's not enough, and it's getting worse, and we need to do something. So, thank you.